the impact been on Beyond Blue and mental health services in general as we've progressed through the coronavirus pandemic?
Well, what we've seen is a big surge in our Beyond Blue phone advice line. So about 30% of our calls now are COVID mental health related. And they're everything from, people worried about the infection, to worried about losing their job, to worrying about how do I manage at home with my partner and one of us working or not working and kids suddenly at home. So a massive transition for people, and we're really trying to help people be proactive about their mental health during this time.
There are so many reasons for us to be anxious at the moment, or perhaps it's being scared or sad even. I think we're grieving a lot as well. Is there a difference between that and people who are actually experiencing mental health issues?
So one of the things that's tricky for people at the moment is we have a very real threat. And anyone who's been paying attention to the news, which you just couldn't help but do, will know that this virus is really nasty. You should feel when you're making all these efforts and following the government's guidelines and self-isolating, not only are you helping yourself, but you're helping other people as well. So you should feel good about that. So appropriate worry is just human and totally normal. And, if you're not worried at the moment, you're probably not paying attention to what's going on. That is different to a mental health condition, for example, like anxiety, which by definition is, disproportionate and excessive. Quite a big challenge for people. And I think for Beyond Blue, we really want to see people get through this mentally well, so they arrive at the other side of this very surreal time, in good mental shape.
Can you give us some advice as to how to do that? How can we be proactive?
Look, there's lots of things you can do. So first of all, keep a good sense of hope. As a public health professor, I'm very confident that our clever scientists are going to find vaccines and treatments. So this is a temporary thing, but it is a marathon. It's not a sprint. So you want to get into a good rhythm. So that means routine. So if possible, get up, get dressed, manage the day like it's, an everyday. But I think the other things that you can do personally are look after your physical health. So keep up your sport, whatever that might be. Sleep's a real tricky one because we're all a bit worried. Very easy to wake up at night and your mind racing worried. So I've been recommending to my patients that they put a pen and pad next to the bed. If you wake up, write down what's worrying you, and so I'm going to deal with that in the morning and try and go back to sleep. I like to comment on the social media and the media because I don't think we've had a crisis like this where we've got such incredible 24-hour news cycle access to information. We just have our phones buzzing away all day. So I would be very focused and disciplined about what you're doing with that.
Well, it seems the key message here, Grant, is please reach out because there are many ways that people can help you.
I think that's exactly right. If you're having a hard time, you feel the wheels are becoming a bit wobbly, don't wait till you get in a mess. Ring someone up. There's great psychological skills and support that you can get. Don't spiral into sort of despair about it because we're going to get through this and there's lots of great help out there for you.